Do we have a quorum, Madam Clerk?
Yes, we do.
All right, so it's 1:32. We will call the Committee on Health and Human Services to order. Roll call, please.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki?
Here.
Commissioner Daub?
Here, I'm located in Andover, Minnesota.
Thank you. Commissioner Anderson?
Present.
Commissioner Killeen?
Here.
Chair Baker McCormick?
Here.
You have a quorum present.
Are we recording?
Yes.
Okay, because I didn't hear the "we started recording" sound. Okay.
Next item.
B, approval of the February 23rd, 2021 meeting minutes.
Move approval, Anderson.
Colleen supports.
It's been moved and supported. All those in favor?
Aye.
All right.
Aye.
Aye. Any objections? Any abstentions? If none, motion pass. Next item, please.
C, unfinished business. There is none.
Next item, actually, I've just noticed there is no chair report here. I just wanted, before we move on, to give a prayer to Al McCants. He was is a longtime employee of the JDF, and he's been dealing with some very serious health issues. His wife is Ebony McCann. And so I just want to send out prayer to him and his family. Also, our next meeting, we're going to have Velva Bowles. She is a doctor who has studied the ins and outs of each of the vaccines. And so she will come to just advise us and tell us all about the various vaccines. So that's going to be our next meeting, which is March 23rd. And that is it. And so for the next meeting, can we make sure that there's a chair report on the agenda?
Yes, I will get that handled.
Thank you, Madam Clerk. Next item.
Item D1 under new business, an update from Dr. Hamami regarding COVID-19.
Dr. Hamami, is he on the line?
Yes, good afternoon. Thank you, Madam Chair.
Good afternoon. Thank you.
If I may share my screen, please let me know if you can see the PowerPoint presentation.
Yes, we can.
Great, thank you. Mohanad Hamami, Chief Health Strategist, Wayne County. I'm going to go through some of the regular reports that we do about our cases in Wayne County. This is covering the period of last week between March 1st and March 6th. We are seeing a slight increase in the past 2 weeks. In fact, this week we have seen 22% increase in the confirmed cases, and we have crossed the threshold of 1,000. We were down back in January below 1,000. So hopefully this trend is a fluke and it doesn't happen going forward. That might be due to a little bit of the opening and the relaxation, but it should not be continuously happening. The death is still plateauing. It's not as much as we have been seeing, especially early on. And our testing is still robust and cumulatively, we have passed the 1 million tests in Wayne County. We are currently at almost 1.2 million tests. This is the 14 days look back on the cases. And again, the trend, that linear line is going upward. If you recall, when I presented 2 weeks ago, that was going down. And it is this bump here that we saw in the end of February and early March. So hopefully we will adjust that as we move along. These are the top 10 communities with the highest cases. No major changes. Still, the top 5 are still the same, or even the top 10 are still the same. They just trade places. But if you look at the total absolute numbers, then you can see that almost every community has increased in total numbers. And specifically when we talk about Dearborn, that has been since the beginning of the pandemic with the majority of cases. That percentage almost a month ago was 12%, now we're at 18%. And we're also seeing more of the youth testing positive. Our 7-day positivity rate is also climbing. It was declining. We were at some point in November at 13%. We would like to see it below 5%. We were going in the right direction. And currently, this week we have jumped over the 5% to 6.4. And this is something similar to what is happening in the state. So it's not only relevant to Wayne County, but it's all over the state. And again, I truly believe that it is because people feel more relaxed with the lifting of the restrictions. School-related outbreaks, we have several new ones that happened last week in several of our communities, 2 in Canton, Grosse Pointe Woods, Westland, Northville, Allen Park, and in Dearborn. Most of those are in students, and most of those are related to indoor sports. So again, as much as we know, we have worked with our schools and they're doing an amazing job in the mitigation and prevention, it is these activities that require the youth to congregate, and sometimes they let their guard down, and this is where most of those cases that we are seeing. As far as the variant, we have 17 cases in Wayne County of the B117. This is the UK variant. The highest number of cases are in Dearborn Heights, followed by Dearborn and Canton with 3 cases, and then 1 case at each of Lincoln Park, Livonia, Redford, and Riverview. There has been this morning, we announced that in Jackson, Michigan, there has been 1 case of the, I believe it's the Brazil variant. So we're watching that closely. There hasn't been any other variants in Michigan beside those 2, with that 1 new in Jackson. As far as the vaccine, we have seen an improvement in the allocation of vaccines. We're fortunate that we also got a very good boost of the Johnson & Johnson vaccine. Last week, we received about 14,000 doses of J&J. We are seeing less shipments of Moderna versus Pfizer. However, in total, between the first and second doses that we got with the J&J vaccine, we have received close to 112,000 vaccines as of end of last week. We have administered about 75,000 of those doses, and we redistributed close to 12,000 of these doses. When we say we redistributed, these are the entities that are labeled as COVID-19 providers and can administer the vaccine, specifically talking about what we're doing with Livonia Fire Department, Dearborn Fire Department, and some of the health providers that are certified by both the state and the CDC. So this is our vaccine inventory. Many of you know that last week there has been a change in the state's priority groups as announced by the governor. The change is that now included are the 50 and over with pre-existing conditions, as well as caregivers of children with special healthcare needs. And that went into effect yesterday. In 2 weeks from now, March 22nd, they will include the 50 and 64 years that are not covered. So technically it means anybody that is 50 and over can get the vaccine regardless whether they have a condition or not. Also, one group that was less announced, however, it was moved by the state, are the agriculture and food processing workers, and that started on March 1st. However, it was probably, the news was obscured by this group that moved, which are the 50 and over. The other essential healthcare workers that everybody ask about, these are the manufacturing, the government, the postal, transportation, are still, as you can see, scheduled for May 1st. And so are those that are under the age of 50 with disabilities and pre-existing conditions. They are still at May 1st. Of course, all those dates are depending on whether or not there is enough vaccine supply. But with the indications that we're seeing, with more production of the vaccine, it seems that this timeline might still be applicable as we move along. How is Wayne County mimicking this? We have been since the beginning following the guidelines of the state. We did not move outside and included groups that should not be included. As I reported, we have done everybody in phase 1A and almost phase 1B in terms of the frontline essential workers. We are now getting the education, the teachers and education staff and law enforcement their second doses, as well as we still see the necessary healthcare, but in smaller numbers, and we are doing their doses as well. We haven't started the agriculture and food processing workers. We are currently assessing how many are in Wayne County. We received a list from MDARD. This is the Michigan Department of, I think, Agriculture and something. Don't quote me on the on those. But we received a list. We're filtering to who is in Wayne County. We identified close to 85 facilities in Wayne County. These vary between food processing to dairy products to animal food makers and all that. Our plan is to reach out to those entities, do a survey for their staff, how many they have, how many are willing to take the vaccine, and as soon as we complete that list, then we will start allocating some of the days for them. We are continuing to do the 65 and older. They are in progress. Some of the communities that we were there 3 weeks ago with a Pfizer vaccine are now at their second doses. So we're doing that. We also included for communities that we are still to vaccinate, that they should include the 50 and over with pre-existing conditions. Those communities that we have covered already, we are going back and allocating some days at our Wayne County Community Clinic, as well as Schoolcraft Community Clinic, and possibly in their communities to include the 50 and over. That leaves us with the last priority group that was moved yesterday by the state, and these are the caregivers of children with special healthcare needs. We are updating our online pre-registration link to know who those people are or where they are. There will be, there will be a link within the next 2 days, possibly, for anyone who fits this category to go online, submit their information, and we will schedule them, and we will start scheduling them as we are moving this population. Those that are 50 and over, again, as I mentioned, according to the state, this is close to the end of March, depending on, again, how much vaccine we are getting and the consistency of the vaccine. By that time, we will consider when to get them in line. Lastly, as many of you know, we started doing we started vaccinating our seniors in partnership with communities. So far in the past 2 weeks, we have vaccinated close to 20,000 of our seniors across the 4 regions. We are still using the regional approach. We have almost every community except 2 or 3 that are lower on the social vulnerability scale that have not been vaccinated by now. The 2 self-vaccinating or self-administering communities are still Livonia and Dearborn. In fact, Dearborn has taken all the responsibility for all their regions. They are doing Dearborn Heights, Redford, Allen Park, and that covers all their all their region. We have for this week, we have these almost 18,000 doses scheduled, and we are conducting those in some at the communities, as well as we are seeing many at our Wayne County Community College and Schoolcraft College with coordination with the community. So by end of this week, we will have done 18,000, and we have already done close to 20,000. So that's about 38,000, which is quite an accomplishment. We still push forward. We still continue to add more to our vaccine priority groups, as long as we are still getting the vaccines that we need. I think this is my last, and I'm going to stop here and answer any questions that the committee might have.
Thank you for that presentation and all the work that you and your team does to get all of these vaccines out. And we know that it can be a tough job. So we thank you for that.
Thank you.
Just wanted to clarify the process for the special needs community. You talked about that, and I'm glad that the state has prioritized them and moved them up on the list. But can you talk about that process again to clarify where they need to go to register for the shot? Do they need any additional information to input in the system when they're requesting their appointment?
Right, absolutely, Madam Chair. So these are two groups. You have the 50 and over that have pre-existing conditions. Those are going to be treated similar to the senior population through the communities. So every community that is reaching out to their senior population are now including their 50 and over with pre-existing conditions. As far as our requirements, we are not requesting any proof or a doctor's notice. We have been always using the honor system, and we still expect our residents to follow this system, and hopefully no one is going to abuse that. As far as those that are caring for children with special healthcare needs, because they are not limited to one specific community and one specific group, these are the ones that we are going to include on our online registration system. Currently, we have a link on our website that says request for a vaccine, and that includes all the categories that are part of the priority. We started that with the healthcare providers, and it worked very well. So now we're adding an extra checkbox that says, I am a caregiver of a child with a special healthcare need. Again, we do not need any proof. We are not asking for anything beyond their word that they are in that priority group, and they can and they need the vaccine.
And also for the Johnson & Johnson vaccine, is there a certain location that you're only administering that vaccine like you were with the Pfizer and Moderna?
At this moment, no, but it is something that we are considering. We are waiting to see if we are going to continue to receive. I know there was an initial limited production of Johnson & Johnson, but one of the things that internally we're considering is a third clinic where, or maybe two more clinics where Johnson & Johnson are being provided. Currently, we are using Johnson & Johnson in our offsite, where we have to go, so there is no need to come back for a second dose. I know the city of Dearborn wanted more of the Johnson & Johnson. We gave them, actually this morning, because now they're doing their whole region, we gave them 4,000 of the Johnson & Johnson in addition to 3,000 of Moderna. Livonia asked for a break this week. They are doing their second doses. They got 570 of the Pfizer. They also got 200. They asked for 200 doses of Johnson & Johnson as they are going to those group resident and homes. If there are any new residents, then they will use it. So a lot of our communities are happy to take that and use it because it's easier logistically from handling and storage, and it eliminates the need to come back for a second dose.
All right, and then my last question, is there a choice that is being given between the different vaccines at this point?
If you are asking whether people can choose,
Yes.
unfortunately, no, because it's all limited on the supplies that we're getting. If at one point the only thing that we have is Johnson & Johnson, then the choice a person can have is either to get vaccinated or not. So since we are not running clinics that have all three in the same location, then someone who shows up at, let's say, Schoolcraft College cannot say, well, I want Pfizer and you're doing Moderna. Then we tell them, we're sorry, you can go somewhere else. And this is how we're going to handle it. If we open that door, in all honesty, I think we are going to get into too much complications.
Yeah.
Thank you. Thank you. So I will go now to my committee. Vice Chair Tim Killeen, did you have any questions?
Yeah, just a quick one. You caught me while I was raising my hand. Thanks for being here again today, Dr. Hamami. I'm going to go back to your vaccine inventory slide that showed what 112,000.
Yes.
That wasn't for this week, was it?
No, that is as
cumulative.
Yes. Oh yeah, since December,
Yeah, okay.
18. Yeah.
Yeah.
Oh, I
so,
wish. I wish we got that one.
Well, and I'm trying to track this also as a policymaker and being able to answer questions. What did we receive last week, or this week, I should say?
This week, so we get our shipments on Monday. So
right.
Yesterday, I believe we received about 1,700 doses of Moderna for first dose, and probably close to 4,000 for second dose. We received, and Carol, please jump in, I don't have the numbers in front of me, probably another 6,000 or 7,000 first dose Pfizer, and another 5,000 second dose. And we did not get any extra J&J because last week we got 2 shipments of the J&J.
Yeah, because I thought I saw somewhere that the state committed to a schedule now. I know we used to order it, but now the state we're just going to send it to you. And I thought they guaranteed like 20,000 first shots a week, something like that. So where are we at with that right now?
Right. So the state almost 4 weeks ago stopped telling us to request doses. They said you no longer are going to request it. We will allocate those.
Right.
In terms of guaranteed and consistent shipments, that hasn't happened yet. We are still guessing. I think our biggest concern, or at least my biggest concern, as someone who is trying to schedule ahead of time, when 1 week we get 10,000 doses of Moderna, and the next week we get 2,000 doses of Moderna.
Right.
And
right.
that is still happening.
Okay. Yeah, I guess Mondays then are some sort of weird Christmas morning. Let's see what's in the, let's unwrap this and see what's inside. Big surprise.
Yep.
Well, that's unfortunate because again, that is really makes it difficult on everybody that you plan for a kind of certain number and get people signed up and then have to backtrack off of that. And that's a lot of the frustration that's out there from that. But great report, Doc. Thank you very much. Thank you, Madam Chair.
Thank you.
Thank you, Commissioner Killeen. Commissioner Anderson.
Thank you, Madam Chair. I just wanted to, I apologize, but I've got a few questions. I wanted to ask, first of all, can we get a copy of this today, this presentation sent over to us today?
Absolutely, sir.
Okay. There was a slide that indicated the vaccine update, the number of cities that had received that. doses administered. One that pops out for me is Garden City is not listed there. And I know they're in the same group as the Dearborn Heights, Melvindale, I believe, but there's not any indication of how many doses have been given to Garden City.
Correct, sir. Good catch, Commissioner. We approached Garden City several weeks ago, well, 2 weeks ago to be exact, and they indicated that they wanted the Garden City Hospital to administer doses to their residents. We dispatched 500 doses of Moderna to Garden City Hospital, and that was our understanding. However, mid last week, I got a call from the CEO of Garden Hospital saying that the city is requesting to take their own doses and administer those. They don't want they don't want the hospital to administer that. Unfortunately, this is not something that we can allow because the city does not have the license and all that. So we communicated with the city, our deputy health officer, and reached out to them. And then finally, they agreed that they want to be included with the Dearborn plan. And we received from Chief Murray from Dearborn that they, and I also got a email from their emergency management person that said they are now part of Dearborn. And now that makes Dearborn again responsible for all I'm trying to think. I think I'm confusing the community. Probably Garden City is scheduled for, Carol, can you correct me? Yes. Garden City is scheduled, my apologies, I was thinking of another community. So Garden City, when we said they cannot take their own doses, they decided they want to hold an event in their community where we will send our nurses, and I think it's scheduled for either next week or the week after.
Yes, I think it's the week. I don't think it's this week. This is Carol.
It's March
It's next
15th.
week,
Yeah,
It's March
yeah.
15th.
March 15th. Thank you.
yes.
March
Yeah,
15th.
March 15th. So that's why the delay, and my apologies, I confused the two cities. But the first part of the story where they wanted to take their own doses is accurate.
Is what?
Is accurate.
Oh, okay.
That we couldn't allow them to take the vaccine and use it on
Right.
their own.
I think it just might be miscommunication because they had always been, I thought, under the understanding, because I had set it up when I was making the contacts and turning those over to Lisa and to Janelle, that who the contact person was and the potential location. And then I think Garden City Hospital became more, I guess, active with the vaccinations, getting a greater supply. But they had always wanted to do, Garden City had always wanted to do that in at the Maplewood Center, which is.
And that's where we're scheduled, correct,
Okay,
Maplewood,
okay.
yes.
And you said that would be March 15th, the week of March 15th?
Right, Lisa, is that correct?
No,
Yes, it is March 15th. I spoke with Doc Dockery,
Right.
and we have confirmed the date of March 15th when our nurses will, as Dr. Hamami shared, will execute a vaccination clinic at the Maplewood Center.
And do you know how many days that'll be and how many doses?
They
I-
have,
yeah, Lisa, I have it pulled up.
okay,
It
it's
is-
500 doses to my
Right.
knowledge.
Yes, 500 doses on Monday, March the 15th. Just that one day is what they have scheduled so far.
Okay. Now, the schedule of making the return trip to the communities that have already had an event in their particular communities, when will we see a schedule of that? Is that what this vaccination update, this only indicates how many have been given so far? What about the
Yes.
return visit when they're going to be either doing the second doses or when they're going to vaccinate additional people for the first time?
Right. So I believe next week will be the first communities that we administered Pfizer vaccine. That makes it 3 weeks. We have them scheduled as well, and it's always been a practice that Where you get your first dose, you will get your second dose to eliminate confusion. So we are going back to communities where we were, such as Romulus and Melvindale and others, and these are scheduled. We can provide that schedule as well.
And what about for first-time vaccinations?
Right. So we have also next week, which is the week of March 15, as well as the week after, we're starting to fill the days at Schoolcraft and Wayne County Community College with the appointments that we're getting from communities. So we are coordinating that with communities.
I can't speak for everyone, but I'm not seeing that notification or anything to be able, because I'm getting, and I'm sure other commissioners are getting a lot of questions about when those are going to take place. Can we get a little better communication as far as when those return visits for the second dose and also the new first dose visits, when they'll start again? Can someone provide us that in a schedule?
Sure.
Yeah, because I'm getting a lot of questions without any way to answer them without the information.
Yeah, and most of these, Commissioner, those dates, the amount, when they want to come, where they want to come, and all that are basically what every community is telling us. We are not dictating where and how and all that. We offer them the schedule, and they say, on such a day, we can send you 1,000 to Schoolcraft or 1,000 to Wayne County, or we want you to come to our place. So that's what we're doing.
I know in particular Westland, I think they kept the list open, and I think they've already got at least another 1,000 people waiting for the next first dose opportunity. Do we know when there was another slide that had farm workers and food preparation, I think it was.
Right, agriculture and food processing workers.
Now, does that include restaurant workers?
No. The list from Michigan Department of Health and Human Services does not include neither the restaurants and food establishments or the supermarkets.
Okay, when would those come online?
Those would be probably included under other essential workers, which, as far as we know, is currently May.
Do you say A and the group?
No,
one?
May. No, yes, other essential frontline workers. That includes those.
Okay, so that is 1B then.
Yes.
And what are we looking at time-wise? Still like
Again, if you look at that green bar, I don't know if you're still seeing my screen. That green bar starts in May. So there is no indication that they're moving yet.
Okay. And when will we, okay, I have that schedule. I mentioned that earlier. We're going to get that. The schedule of when these cities are going to get their next vaccination events. Do we have any plan right now how we're going to ramp up if these numbers keep increasing in the number of vaccines that we're getting? Are we, what is the plan, I guess, is what I'm trying to determine how we're going to ramp up, because the numbers we're doing are great, but it's not probably going to address the great volume we're hearing anyway of vaccines that we're going to start getting.
Right. So there are several things that we are currently doing. We certainly are expanding our partnership with self-administrators, or those that can administer vaccine. This has been a wonderful partnership. We are benefiting from our also partnership with the Michigan National Guard. Almost every day, or at least 4 to 5 days a week, we are getting close to 10 teams of the Michigan National Guard that are helping as well. And lastly, there is an RFP that I believe was released on Friday for looking for entities that can help us as third vendors that can do community vaccinations.
Okay, so you said with the fire departments, that are we doing those right now? The fire departments under the supervision of the nurse, county nurse?
Yes.
Okay, and that's some of that taking place at Schoolcraft, correct?
It's more taking place when we go to their communities in Schoolcraft. If they are willing to send their EMTs, we will be more than happy to accommodate those. We heard from some that said there are some jurisdictional limits on a municipal worker working outside of their city.
Okay. And when will the senior high-rise units and those that have 300 to 500 seniors and sometimes some cases more, when will they be getting on-site vaccinated?
They actually are. So we have compiled a list. Almost 60% of those have been vaccinated by when we are in those communities. There are several that are not. I counted 25 probably that are still not vaccinated. We are again coordinating with either the EMTs in that community, or if there is a need to send our nurses to those buildings, that would be our second option.
Okay. In particular, Garden City and Inkster and Westland, I haven't heard anyway. I've been getting calls still. When is it coming?
Right.
I
I know Commissioner Dearborn specifically did those first, and they also are doing some of the others in the communities that they're vaccinating. Livonia for sure. I am in contact with Chief Hevner, and those were like this week, the 700 doses that they got are for those that are in residential settings. I think we heard from Mayor Wild from Westland, where he has either 60 or 90 people in a building where he wants us to help with that, and we're currently assessing whether his firefighters can do that. So these are all things that are in process.
Okay. And last question, I know I hear a sigh of relief from everyone, but there's a lot of concern that I'm getting from people that with the increase in the groups that are being vaccinated with the 50 and up crowd, that the 65 and older are going to have a harder time getting their vaccination. And I know that wasn't your decision or the county's decision alone, but it's doing the same thing to us. I think that it's causing a lot of additional concern, maybe unnecessary concern, that it's going to be more difficult for the first group to get their vaccination. Just wondering.
That's a good point. As long as we get more vaccine, then I see that as a good problem, that we can vaccinate more people. We have the capacity, we have the demand, so it's just a matter of the supply. But yes, it is a concern. Hopefully we don't have to get into it, and the state had some logic when they opened, because you're right, this is close to about another 200 to 300,000 people that were dumped in one day.
Yeah.
So yes.
Seem to be very ill conceived. I understand the benefit of getting people vaccinated, but if we're going to make it more difficult, I think, when you throw more people into the mix at one time. But anyway, thank you very much, Doctor. Appreciate what you're doing.
Thank you, sir.
Thank you, Commissioner Anderson. Commissioner Dobb.
Madam Chair. Actually, most of my questions have already been asked, but I do have, I think, three. So with the group with the underlying health conditions, so I know, Dr. Hamami, you said we are not going to require any proof or doctor's notes. Should we even ask, like on our, on our appointment schedulers, should we even have a box on there that, check this if you have an underlying health condition?
Oh, absolutely. Absolutely.
Okay.
Yes. Yes.
All right. So,
yes.
but don't go any further than that. Don't ask them what it is. We're just kind of concerned about, we don't want to violate any HIPAA.
No, certainly.
laws.
Yes. You're absolutely right. You're absolutely right.
But it's just okay to just, to verify that they do have that.
Yes.
And then, so the group for the caregivers with children caregivers for children with special needs. Is there an age limit on the children? So I know like sometimes there's parents who are still caring for adult children with special needs that might be over the age of 18. Would they still qualify?
Yes.
Okay, all
Yes.
right. And then, oh, my last question was, this is kind of obscure. I got a call from a constituent who is allergic to an ingredient that is in the Pfizer and Moderna vaccine. So he was wondering when the Johnson & Johnson vaccine would be available in the county and like where he might be able to get that. If I know you mentioned Dearborn had requested some, I don't know if there's like a special way that I could just get this one person.
If you don't mind, Commissioner, if you can send me a note and we'll
Okay.
see wherever, because we have some providers that are currently going to have the J&J and I can probably connect. If it's one person, it's easier to do.
Yeah. Okay, wonderful. Thank you so much. I think that was it. I had some other questions, but other commissioners covered everything for me. So thank you, Dr. Hamami.
You're welcome.
Thank you, Madam Chair.
Thank you, Commissioner Dobb. Commissioner Marecki.
Thank you, Madam Chair, and thank you, Dr. Hamami. I really appreciate everything you're doing for the communities, especially, of course, my communities. I just have a question because Commissioner Dobb asked a couple that I was also wondering. But this phase 2, the 50 to 64-year-olds, it's supposed to start March 22nd. Will the communities like Livonia be able to continue to give the vaccines in that group as well?
I don't see why not, as long as we have enough vaccine to distribute and they are willing. In fact, it would help us tremendously, yes.
Okay, and then the date of the 16 to 49 is just, there's no date on your chart yet. Will that also involve communities, or is that going to be the same setup with that?
I'm not really sure, to be honest with you, Commissioner. It all depends on how much are out there and whether we can say, let's say there are 500 just in Livonia, then yes, we can say, come to the Civic Center or wherever, and Livonia City can deal with that. If they're less, and we can do them, let's say at Schoolcraft or at other places, then that's what we're trying to get. That registration link is going to give us a good estimate.
Okay. And right now, Wayne County is just doing the registration link for the caregivers of the kids with special needs, correct? Go ahead.
That is the intention for now, yes.
Okay, that clears up everything. And thank you again. I know for 1 year, you guys have been working 36 hours in a 24-hour day. So I appreciate everybody. So thank you.
Thank you.
Thank you, Commissioner Dobb. And I see that we have any other commissioners? Looking through here. Any other commissioners have any questions? That's on the line.
Yes, Madam the Chair, Commissioner Harris.
Oh, go right ahead, Commissioner Harris.
Thank you, Dr. Hamami. You answered too many good question, but I have one left. I think it bothered me a little bit in the news when I heard one of the veteran, 92 years old, was turned out to not qualify to receive the vaccine because of his income. And it was on the news. And that was not acceptable in situation like this by any mean, doesn't matter. Is Wayne County have special unit for the veteran, or we contract for them with the veteran hospital in Detroit, or how we dealing with the veteran in Wayne County?
Thank you, Commissioner. First of all, I assure you this will never happen in Wayne County. We don't have any requirements or checks for any income or pay status or whatever. As far as the veterans, we are not differentiating them. They are part of the priority groups. So a veteran that is 65 and older can get a vaccine because of that. A veteran who is now 50 with an underlying condition is going to get that. A veteran who is 50 and over by March 22nd or whenever that date comes will be that. So there is no special category just because the state did not prioritize them as a special category. We are including them as we are approaching every priority group as they qualify.
We have the Veteran Affair in Wayne County under the leadership, Mr. Petzerai. He's a veteran himself. Is there communication between you and him to encourage him to guide the veteran to come to any site in Wayne County, wherever they live, to make sure we let the veteran know you not put in different classification or different vaccine place? You welcome to come to anyone in Wayne County.
I will let him answer that, but we certainly are. Again, it is still the same department, whether it's public health or veterans and other divisions within the Department of Health, Veterans, and I forgot the new name. During my day, it was a different name. But yeah, I'll let Kwesi answer that if there is any extra need that we need to do with the veterans.
Well, you know, I know you could resolve too many problems if we receive enough vaccine. I know with the limited number you have, Wayne County, I think, managing very well. But my question, all the vaccine have expiration date. Do we have any vaccine expire without being used since we started in Wayne County?
Absolutely not. In fact, they go out as fresh as we got them. We have days where, unfortunately, we had days where we had to turn people away because we had less vaccine than we scheduled.
Well, I want to thank you and thank Wayne County for being on the front and managing very well, in my opinion. I watch and I respond to too many calls in my district, but I see things moving with what we have. I wish we have more to respond. I can't thank you enough for that, and anything we can do as a commission to voice our opinion to the state to get more, we like to know from you and the administration if there anything we could do to be more effective and getting more vaccine.
Absolutely, sir. Thank you.
Thank you. Thank you.
Thank you,
Madam
Commissioner.
Chair.
Thank you, Commissioner Haddis. And again, thank you, Dr. Hamami, for joining us and giving us that extensive report. And thank you for all that you do.
Madam Chair.
Pleasure.
Oh, yes, you had
Just one
another
last question. Somebody sent me a message and asked me to ask a question about, my question is, what happens, Dr. Hamami, when we're doing a single visit in a community and we have vaccine left over? Are you saying that we don't usually have any left over, or do we have people on an on-call list or something like that, that they can rush in on a short notice when we have left over?
Yes, it's actually all those combined. So we try to not open any vial until we do, especially when we get towards the end of the shift, we do a count. We look at how many are left and all that. We do have we call it a standby list. These are those that can get in within 20 to 30 minutes max that we can call, and they said, yes, we are coming. So far, I can assure you, since December 20th, we did not have one single dose that went to waste. And my philosophy, and I'm going to be extremely honest, at the end of the day, you're left with 2 doses. Even if you stop a person on the street and give them that dose, then don't waste it.
That's right. That's right. Good policy. And the other question is the feds, I understand, do not allow for the vaccine that's left over in the vial itself to be saved and put with another dose. Or
That is correct.
bottle.
That is
Is
correct.
that still the policy?
Oh, yes, absolutely.
So there probably is something less than a one vaccination dose that could be combined with another and vaccinate someone.
Yeah, there has been, because when people discovered that, especially with the Pfizer, when they discovered that the 5 dose vial actually gives you 6, and I can tell you, I have drawn those. You can get 6 easily, and then so the dose is 0.3 mils. So you can still draw 0.2 ml as a 7th dose, and as you said, if you could combine it with another, then that gives you an extra dose in every 2 vials, but it was absolutely recommended against, and we're not using that.
Wow. Okay. All right. Thank you, doctor. Thank you.
Yep.
Thank you again for coming to our meeting today.
Thank you, Madam
We
Chair.
appreciate you. Mhm.
Always a pleasure. Thank you.
All right. Madam Clerk, the next item, please.
Item 2, CARES Act funding update from the Health, Human and Veteran Services Department.
Through the chair, this is Kamal Kaparu, Management and Budget Finance Director for the Department of Health, Human and Veteran Services. If it's possible, I would like to share my screen for the presentation.
Great. Go right ahead. Good afternoon to you.
Good afternoon. All right, what I'll do is I'll go through the presentation. It's not long, it may be about 10 slides, but who we have on this call, we have the HSVS team members. We got Ms. Kara Osterberry, Dr. Shanetta Coleman, Jennifer Caruso, Kwesi Bessarai. We have Brian Medow from the FQHC. Also, we have Ms. Lisa Whitmore from Senior Citizens. Included on this call, we have Guidehouse, a few Guidehouse rep. Guidehouse is the organization that's helping us manage the CARES Act fund. Last but not least, Dr. Hamami. Of course, he just did an excellent presentation, but it may be some, after I go through mine, it may be some questions for him. That's it. So I'll go through it. Any questions, just please stop me. And if I left any other member out, please just chime in at the appropriate time. All right, first, HSVS respond to the public health crisis. Just a few bullet points. We distribute distribution of $4 million worth of PPE to protect county first responder residents. And if you just scroll, if you go over, I won't read each point. Going down further, we had the food program partnership with Gleaners and Forgotten Harvest. We maintained the COVID infection rate between 1% to 3% in the jail and juvenile detention facility throughout the pandemic. The next slide, of the total 188 million, our department, we've been allocated 15.2 million of that amount. Here's a more detailed breakdown of the spending in our department. I'll go from the top at furlough and I'll go to the left. You got furlough at about 554,000. The furlough represent the employees that got furloughed at the time, right when the pandemic started. We was able to bring some of those employees back by using CARES Act dollars. You see Veteran Housing Initiative, you see COVID testing for jail, you see IT operations and support for COVID, you see staff contract for COVID support, you see the food programs, medical supplies and expense, I'm at the bottom now. You got PPE for county residents. On the bottom on the right-hand side, you got PPE for first responders. Going on towards the middle of the screen, moving towards the top. You have COVID-19 testing contract tracing. You see that's the largest amount at 6.5 million. At the top, you have COVID-19 administrative expenses, and then all the way at the top, last but not least, for payroll. Here we wanted to just show the top vendor spending of those funds, and we wanted to just outline it by the vendor, the project, what services they're providing, and then lay it out by division, and then the total spend. This slide here is key. We wanted to show the funding. Now, even though we received 15.2 million in CARES Act funding, we have also received about 7.1 million from the state, through the public health department. One thing I wanted to highlight here is that one of the things that we're working diligently on is making sure we maximize all our grants. Because what we're trying to do is spend, of course, the money we get from the state of Michigan first before we use the CARES Act money. Our position, we really don't want to send any of those state funds back. So we're working on really maximizing that. And those who've been on the committee a while know that the state constantly is adjusting the budget. So it's just like kind of a dancing act to make sure we're prioritizing our state funding first. And then, of course, we're picking up with the CARES Act funding. And here, this slide, we wanted to show, again, another view of the CARES Act spending, but show here some of the departments that we're collaborating with the CARES Act funding. So you see, I'm on the right-hand side, you see our department of 15.2, but we also working with senior services. You see 485,000, definitely working with the sheriff's department. You see they've been allocated 63.7 million. Of course, the county exec office, 3 million. And last but not least, Homeland Security at 3.9 million. So we got this slide here just to show you some of the departments we're closely collaborating with. Now, this slide here, Dr. Hamami alluded to it. This is what we're working on closely as far as preparing for vaccine. So this is a quick vaccine funding overview. We have been talking with FEMA, and we're looking like we're going to receive about 72 million from FEMA soon. And we're working on a major vaccination program. And if you see there's a chart over to the right. Can you all see that? I don't know how big it is on your side.
Yes, we see it.
Okay, perfect.
Yeah, the one that shows a map of the county.
Yes, sir.
I got it. Thank you.
Okay. So just wanted to show that, and that's what Dr. Hamami was briefly speaking to. And that is it. So if there's any questions or comments, please, we can take them now, and whatever division, the appropriate person will just step up and respond to the question.
All right. Thank you for that presentation. We will start with Commissioner Colleen.
Thank you, Madam Chair. And thank you, Mr. Kepperu. I'd like to go back to your very first slide. This is the information that folks are dying for out there to hear what the county is doing. This is an excellent kind of, a summary. And this is only through December, correct?
Yes, sir.
So when will this report be updated?
Well, we updated it as needed. So right now, what we did, work closely with Guidehouse, because like I said, they are assisting us. So as we go, we would update it. So I don't have a pinpointed date because we're running it. What they say, we're fixing the plane while we're flying it.
Yeah, well, everybody's doing that. Not fixing it, building the damn thing.
Yeah, you're right about that.
Trying to get the blueprints to quit blowing around in the wind. I would request this. humbly that we get, I think this is the kind of data that my constituents and a lot of people are looking for. What is the county doing with all of this, you know?
Mhm.
I would like to get this, however, can't use it as a PDF. Got to use it as a JPEG file. And that's true of all commissioners, so that we can share it with our constituents, show them what we're doing, right? These things are very difficult to describe verbally, right? So what I am attempting to do, and I've been attempting to do for a while here, give people information. People, for the most part, aren't stupid. Give them information. They can look at it and kind of make up their own minds about what's going on. And so I think this is very good. And so I'd like to get it in a JPEG format, or something we can use on social media. But I think the more of these kinds of documents we can get out to citizens, I think the better, because there's so much confusion that people have. So giving them the straight story. I like our infection rates in the jail. State of Michigan's not doing that well in their jails. So that is my request. And thank you very much for this report. And maybe send the whole thing to everybody too, even in the PDF format, but if you can get it in JPEG too, because there's a lot of good morsels in here to help communicate with folks.
Yes,
And
sir.
of course, we've got the 1.9 billion, which the president ought to be trillion. Yeah, my bad. I'm old enough that I have a hard time saying trillion. But the 1.9 trillion, probably early next week when the president signs it. And there already is some info out there in terms of how it's going to come to the county. And that's going to be a whole nother discussion. What are we going to do with it? So I'm looking forward to being able to ramp up all of our vaccine programs once that money gets here, hopefully in 3 weeks or so. All right. Thank you very much, Mr. Caparu. Thank you, Madam Chair.
Thank you, Commissioner
You're
Killeen.
welcome, sir.
Commissioner Anderson, did you have any questions?
He's on mute.
Yeah, I do real quick. I sent you a message. I was gonna let you, but I know it's sometimes difficult to find all the messages. But anyway, I just wanted to ask if this presentation, as well as Dr. Hamami's, could be forwarded to all the committee members by the end of the day. That would be great.
Yes, sir.
And like our colleague, Commissioner Killeen said, if it could be converted into a PDF, that way we can share the information.
Yes, I think that's an excellent idea.
Thank you.
Oh, JPEG, Commissioner Anderson, JPEG.
What did I say?
You said PDF.
Oh, convert from a PDF to a JPEG.
To a JPEG. Mhm. All right. Thank you, Commissioner Anderson. Commissioner Dobb, did you have any questions?
No questions for me. Thank you.
Thank you. Commissioner Marecki, do you have any questions?
I don't. Thank you. This is very helpful to see this all in the graph form, and thanks for all the work you have done to do this. Appreciate it.
Thank you, Commissioner Marecki. And thank you, Mr. Caparu, for your presentation.
Madam Chair.
Yes.
Chair, I did forget one thing. Mr. Caparu, could you tell me where, and maybe it's not in your report for a reason, but where the dollars that were spent to allow people to work at home by the purchase of all the computers?
Let me see. And if a Guidehouse member could speak to that, I want to go to this chart.
Oh, yeah, this
Maybe
is
where
Rebecca
all those
Guerrero
computers went.
from Guidehouse. Those were
Would this be the correct chart or the correct slide that would contain that? Rebecca, you still there?
Yeah, I'm here. Sorry, I was getting a little bit of an echo.
Oh.
So those are, to answer your question, those are actually not part of the HHVS spend. That was done through Do It. They were in charge of purchasing the laptops and other remote devices for the county. So there were some special purchases for the juvenile and youth services so that Dr. Coleman and her team could continue the virtual case management and virtual hearings, things like privacy screens, et cetera, to ensure the confidentiality with, with that division. But otherwise, county-wide remote work was under the responsibility of Do It.
And to clarify, Commissioner Anderson, on this slide where it say rest of the county, 101 million, Do It is a Department of Technology. All the computers were purchased by the Department of Technology, then disseminated out. So that amount will be inside this 101 million.
101,936,000.
Yes, sir.
Okay, maybe, Madam Chair, we might want to dig into that or just get an accounting for how many computers in the end were purchased and where they were all directed.
Yes, I believe this is just the HHVS report in accounting. And I think there was going to be a breakdown in the Ways and Means Committee. Is that correct?
Madam Chair, Andrew Kandrivas from the Executive Office. And yes, that is my understanding that it'll be presented at Ways and Means for the county as a whole.
Right, because I wanted to also see the numbers for the breakdown for the communities that received businesses that receive grant dollars as well. So yes, I look forward to that presentation.
Thank you.
All right, is there any other questions from members? If not, we'll move to the next item. Thank you again, Mr. Caparu.
You're welcome.
Item 3, discussion regarding juvenile detention facility employees' concerns regarding their jobs and COVID-19.
And we decided to table that. Can I get a motion to table that discussion, that item?
You want to table it?
Yes.
Okay, I'll move to table that.
Do I have support?
I would support it, Madam Chair. Do you want to table it or do you just want to pass for the day and have it come up next time?
Table it.
Okay, support.
Thank you. It's been moved and supported to table this item. All those in favor?
Aye.
Aye.
Any opposed? And any abstentions? If there are none, motion passed. Next item, please, Madam Chair.
Item 4, communication from the Health, Human, and Veteran Services Department, Public Health Division, forwarding a report on the Michigan Department of Health and Human Services Local Stabilization Authority funding.
Right, do I have any questions on this item?
I'll move to receive and file.
Board Anderson.
It's been moved to receive and file. All those in favor?
Aye.
Any opposed? Any abstentions? If there are none, we can move to the next item. Motion passed.
Item 5, requesting commission approval of contract modification 32 to a contract with 3 one-year options to renew with Black Family Development.
Any discussion?
I have a question.
Yes.
With all of these, so these are the contract modifications. I thought it was this year we were supposed to get new contracts. What's the status of that? I'm sure COVID didn't help, but.
Good afternoon. This is Shanetta Coleman, Division Director for Juvenile and Youth Services. And you are correct. These are the quarterly adjustments. And you are also correct in that we are in the process of issuing an RFP for these services. That RFP process is underway. These contracts actually will go until September 30th of this calendar year for the fiscal year start of October 1st. So what you really have before you is just a quarterly adjustment that is based on actual services rendered in this contract period. As you know, these adjust and fluctuate based on the days of care by each organization. So the modification would include those adjustments. So depending on where the kids move or where new assignments are made, and SCMO's contractual amount might be increased or decreased based on actual days of care and youth that they serve.
Yes, thank you. So you think the new contracts will be for the new fiscal year then?
The new contracts will be effective October 1st of 2021.
Okay. All right. Thank you. And I know these are what we do every quarter, so I will move approval for this.
Thank you.
Is there support?
Madam Chair, do you want to take all items 5 through 9 together? Or are we gonna do them separate?
Yes, we'll do them separately. Yeah.
Okay, I'll support.
Thank you. And just it's been moved and supported. And also we will have these individual organizations at our upcoming meetings to talk about what they do and how they provide services to the youth in Wayne County, so we get a better understanding. So those meetings will be within the next, I would say, month or so. So just a FYI for you. So it's been moved and supported. All those in favor?
Aye.
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 Any abstentions? Or anyone opposed? No, and any abstentions? All right. If there are none, next item, please.
Item 6, requesting commission approval of contract modification 32 to a contract with 3 one-year options to renew with Bridgeway Service, Inc.
All right. Are there any questions on this item?
Yes, Madam Chair. Colleen.
Go right ahead.
Thank you.
Mm-hmm.
Dr. Coleman, on this one or on any of our CMOs, are we seeing any COVID effect in terms of the number of services that our folks are doing out there?
Not really. The number of youth who have been adjudicated possibly, which those would not have gone to the care management organizations. As you know, there was a countywide effort, even with the courts, for kids who may have been detained for some crime, as long as it wasn't a serious crime, where they may have ordinarily referred them to some of the program services for additional supports. They've postponed court hearings or maybe warn and dismiss, but the CMOs have continued to provide services, as Kamal alluded to, in terms of supporting the families and ensuring that they can continue to do case management. We use some of the CARES Act money to ensure that the care management organizations could also support the families who did not have either access to internet or technology where they can do virtual visits, because in the height of all of this, obviously they could not do an in-person face-to-face, but they had to ensure there was some oversight and case management. So they've been very creative. They were very appreciative of those pieces of technology that help support that work. So they've done a yeoman's job in terms of maintaining their case management oversight for these youth. But yes, there has been some of them, all of them, as a matter of fact, also provide youth assistance program services, which is not a part of this particular amendment, but they've been very creative in making sure that they are in contact with these young people and keeping our numbers down. So yeah, they've been good.
I was just concerned, right? Everybody's had to work remotely and sometimes people have had to lay off. I was wondering if that was the situation. So we provided some support through our CARES Act for things like connectivity, buying some computers, buying some. Have we supplemented with our CARES Act any staffing?
We have not provided them any staffing support, and they are also reporting back to us as well. They have gone to remote work as well for the same reason. Primarily, they've provided their own staff supports with their technology. The issue for us was making sure the families had the technology so that it doesn't negatively impact their court orders and that they are able to remain in contact with their provider. And so the CMOs, use those technologies, whether it was the wireless cards for families who did not have internet services, or they didn't have the technology or cell phones that allowed them to have smart connectivity to court hearings or virtual hearings or virtual visits even. So that's what we use some of our CARES Act monies for.
Thank you. Madam Chair, I'll move item 6 for approval.
All right, and I think as Commissioner Dobbs suggested, that the next 7, 8, I believe, and 9, can you go down, Madam Clerk? Just want to see what, I don't have a, yep, you could keep going. We'll take a motion on 7, 8, and yes. Oh, actually it's okay.
Madam Chair, I'll modify my motion to items 6, 7, 8, and 9 for approval.
And
I'll
yes,
support
9.
that.
Yes.
All
right.
right.
It's been moved and supported. All those in favor?
Aye.
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 Any opposition? Any abstentions? If none, motion passed.
Thank you very much.
All right. Next item, please.
Item 10, requesting commission approval of a grant agreement with the State of Michigan Department of Licensing and Regulatory Affairs.
Any discussion?
Pauline will move this item for approval, Madam Chair.
I'll support Bob.
It's been moved and supported. All those in favor?
Aye.
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 Anyone opposed? Any abstentions? If none, motion passed. Next item, please.
Item 11 on the addenda, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services.
Any discussion on this item?
Move to approve. Anderson.
Any
Colleen
support?
supports.
It's been moved and supported. All those in favor?
Aye.
Aye.
Anyone opposed? Any abstentions? If none, motion passed. Next item, please.
E, such other matters as may be properly submitted before the committee.
There are no such other matters, as far as I know. Next item, please.
Public comments?
Are there any public comments? Can you unmute everyone, Madam Clerk?
Yes, I
Any
do have an
public-
email comment.
Okay. Go right ahead.
Okay, let me pull that up.
Mhm.
Second.
And we don't have any, looks like everyone's still muted. You can
Hello. I hate to interrupt. I just wanted to let you know that I would like to give public comment whenever that's ready.
Yes. And you know what? You can go right ahead while our clerk is looking for the other comment. So go right ahead. Welcome.
How long, Chair?
2 minutes.
Okay.
Okay.
Thank you.
Mm-hmm. And can you state your name and where you're from?
Hello, Council, Committee on Health and Human Services, to be specifically. My name is Rami Alvarez, and I'm a constituent of Detroit, Michigan in Wayne County. I am here to ask that you do whatever is in your personal and collective power to ensure that people with disabilities can get priority access to COVID vaccines. As it stands today in Michigan, people with disabilities 50 and up are eligible for a vaccine. However, the data we have been compiling as disability activists in the area shows that disability is just as impactful as age when determining the rate of contracting COVID, being hospitalized from COVID, and passing away from COVID related deaths. I'm going to be very brief because I see that I only have 1 minute left. But in whole, we came to the Wayne County Commission last week and shared our stories around why the data that we're seeing and also the lived experiences of Wayne County constituents that we are seeing shows that people with disabilities of all ages should be prioritized at some point before the general public rollout. As many of you know, the city of Detroit made this prioritization happen, and since they did, 820 residents have taken advantage of this. Disabilities make things like wearing masks, social distancing, washing hands more challenging because of the way that people with disabilities navigate this world. We know that the issue is supply, and in the last 15 seconds, I just want to say that we organizers are so grateful and impressed by the level of pressure that you all are under and the unprecedented work that you all are doing for this unprecedented issue. We are here willing to brainstorm whatever solutions we can get to make sure that people with disabilities in this pandemic and in future pandemics are more considered when the response is rolled out. Thank you so much. I went a little bit over time. I'm so grateful for your audience today. Have a great day.
Thank you for your comment. We don't go back and forth, but just to let you know, the state has changed the prioritization of those with disabilities. So we're on track to make sure that they get that priority. So next comment, if any, Madam Clerk.
Sorry.
Oh, go right ahead. Mm-hmm. Your name and where you're from.
Okay, good afternoon, commissioners. My name is Amy Peckinpah, and I am a Wayne County resident, and I am a sibling to a person with a disability who lives in Wayne County. Her name is Linda, and Linda lives in a group home. Linda has received both doses of her vaccination, as well as her housemates, and caregivers were also provided the vaccination. However, people with disabilities who live independently or with their family or in an unlicensed setting or with housemates and who may not be connected or receive services from their community mental health system are left out and not prioritized yet and have great risks. In fact, people with disabilities are at more risk for getting and dying of COVID than people without disabilities. So commissioners, I urge you to ask Governor Whitmore and MDHHS for all Michiganders with disabilities aged 16 to 49 to be an immediate vaccination priority. And as you make this vaccination priority for all people with disabilities, please provide easy, convenient ways to share this information about the vaccine and to get the vaccine, such as accessible vaccine distribution sites and free transportation, as well as in-home vaccination options. Thank you so much.
Thank you. Thank you. Any other comments?
Good afternoon. This is Jeffrey Nolish. Am I able to give a public comment?
Yes, go right ahead. And where are you from?
Hi, I'm zooming straight from downtown Detroit. I've been going for my daily walk today. And 2 minutes, right? Starting now?
Yes, go right ahead.
Fantastic. I appreciate the time. My name is Jeffrey Nolish. I am the policy director for Detroit Disability Power. I live in Detroit, Michigan, in Wayne County. And I work for, as I said, Detroit Disability Power, which is a local disability justice organization dedicated to building the political power of people with disabilities in Metro Detroit. And as my colleagues and friends have already stated, you know, we're here for people with disabilities. We are people with disabilities. Our families are people with disabilities. Our friends and neighbors are people with disabilities. And we're here to raise their voice and our voice for making people with disabilities an immediate and higher priority in the COVID-19 vaccination rollout. And you've heard this before, and we've reached some of you via email with my boss, Tessa Cosma. But I know what you're saying. I know what you're thinking. You know what? The supply is a problem, or the CDC says this, or you know, it's MDHHS's job to do this or that. And I want to respond to those in the brief time that I have left. You know, right now, Maryland, Ohio, New Mexico, New York, South Carolina, North Carolina, Utah, and other states have found a way to offer people with disabilities ages 16 and up and 18 and up COVID-19 access to people with disabilities vaccinations under the same constraints as Michigan, right? And an organization called Anchor, American Network of Community Options and Resources, they say there's precedent for counties to get out in front of states, to move independently, to lead the states, to change the paradigm. We're looking for that. You know, people with disabilities are at a greater risk of contracting the virus because of things like physical barriers, access and hygiene. I'm gonna go, all right, I don't have enough time to talk. But right now, my last comment is this: 821 people in Detroit have been vaccinated while we're debating this, right? We want the number to grow in Wayne County. We'd love for you to be the first county to do this in Michigan. We appreciate your time.
Thank you. Any other comments? Any other comments?
I do have this email comment if no one else has anything to say.
Go right ahead, Madam Clerk. Thank you.
This is from Casey Messiter. It says, hello, my name is Casey Messiter, and I am a constituent of Washtenaw County and a student at the University of Michigan and an intern with an agency in Detroit. I am commenting today to say that people with disabilities in Wayne County need to be immediately prioritized in the COVID-19 vaccination rollout. We know that people with disabilities of all ages are more vulnerable to contracting the virus, as well as at a higher risk for having severe health difficulties or death from the virus. My husband, Isaac, has untreated ADHD, which places him at higher risk. My best friend, Eli, is autistic, which places him at higher risk. Another good friend of mine, Sam, has a diagnosis of schizophrenia, making him much more vulnerable to contracting and having serious complications, even death from COVID. I know many of you likely have friends and family, maybe even you yourself, who have disabilities that do put them at higher risk, but do not currently qualify them for the COVID-19 vaccine. Please protect our loved ones and our most vulnerable neighbors by prioritizing people with disabilities in COVID vaccination distribution in Wayne County. Thank you for your work, your time, and for listening. Casey Messiter.
Thank you, Madam Clerk. All right, if there are no other comments, then we can move to the next item.
Adjournment.
Do I have a motion to adjourn?
So moved. Support.
It's been moved and supported. Thank you all for coming, and you all have a good rest of your day and be safe.